The range of motion, or ROM, is the range through which a joint can move or be moved. Range of motion testing is done to determine whether the range is limited, normal, or excessive. The primary goal of ROM testing is to assess the movement of an injured joint compared to its normal ROM. Normal ROM can vary, especially with age. Where possible, we test the uninjured side first to ascertain what is a normal ROM for that person. The client is observed closely during ROM testing to gauge their level of pain or discomfort, its quality and location. Range of motion testing has three parts: active, passive and resistive tests. Active ROM tests are performed by the client who actively moves the joint through its ROM, indicating at which point pain occurs in the available range. Active ROM testing determines the state of the muscular tendinous unit. Passive ROM tests are conducted by the therapist, who moves the joint without assistance from the client through its ROM. Passive ROM tests are used to determine the state of the bones and ligaments primarily, but also the condition of the joint capsule, synovium and cartilage. When the joint is moved passively, the muscular tendinous unit is not activated. Resisted range of motion testing is performed by asking the client to contract muscles while the therapist resists to prevent movement occurring. Resisted ROM tests are used to determine the strength of the whole joint, the muscles, tendons, and attachments. There are some important rules of ROM testing which must always be followed. Test the normal, uninjured, unaffected side first. This is to gauge the client's normal individual range of motion particular to them. Warn the client that movements may exacerbate symptoms. It is important that the client has full knowledge of the consequences of your assessment. In this way, the client will give you informed consent to proceed. Give the client clear instructions for them to follow before each test is performed. Make sure they understand what you are asking of them. Ensure correct and stable positioning of both yourself and your client. Any movements that are painful should be assessed last. This prevents overflow of painful symptoms and helps ensure client compliance. Never stress a structure beyond the point of pain.